All right, gang, I promised you that I'd walk through some of these sample lab values from the end of class the other day. So let's get started on this one. This would be slide 47 in the slide deck. And what we look at here is we're going to just go down the list. We notice that there is a low red blood cell count level. It's not significantly low, but it's a little bit low. The hemoglobin is low. Let's assume that this is a male that we're working with here. Now notice that the reference interval over on the right shows a lower limit of normal of 11.1. But for males, remember, we're going off 13.5 as anemic. And let's also assume that this patient is symptomatic. We look at the hematocrit, that's approximately 3 times the hemoglobin, so that's good. And then we get to the MCV, the mean corpuscular volume. And you'll notice that it is 99, which is high, and the 99 represents an elevated MCV, or a macrocytic anemia. With the macrocytic anemia, the next thing we want to do is check out the red cell distribution width. If you come down a little bit further, you see RDW is 13. That's within normal limits. And so we are pretty confident that the average size of the cell is large without a bunch of smaller cells in there. So the question would be here, based on this one, is what kind of information would you want next? Personally, what I would like to see is a folic acid level, a B12 level, and probably would go ahead and get a methylmalonic acid as well to make sure that we can differentiate between the two. So this would be considered a macrocytic anemia. Lots of different potential causes, but at the end of the day, most commonly it's going to be either folic acid or B12 deficiency. Okay, let's move on to the next one. This is slide 48. We're going to go down the list again. Notice our hemoglobin is low. Notice our hematocrit is low. Our MCV is low. So that means this is a microcytic anemia, and our MCH is low. So while I'm not really going to hold you guys accountable for this, what I would like you to know is that this would be considered a hypochromic microcytic anemia because the MCH is low. So with that MCV of 73, we know that the average size of the cells are going to be small. The RDW coming down is a little bit elevated, which means that either there is a mixed anemia here, or probably more likely what is occurring is that the body is responding to that anemic situation and is releasing more reticulocytes, or baby red blood cells that are large. And the other thing that we don't have here that we would really like would be a reticulocyte count. Now, a reticulocyte count above 1% would mean that there is a reticulocytosis. The body is trying to crank up red blood cell production in the face of anemia. Now remember, with a low MCV, we're probably most likely looking at iron deficiency anemia. However, you can also be looking at thalassemias as well. So probably the best thing to order here to get more info on what you might need would be a serum iron level, a ferritin level, and remember we consider less than 45 low, not less than 15. I'd probably also want a total iron binding capacity here as well, and that would lead us down the road of, is this a thalassemia or is this truly iron deficiency anemia? Okay, we're cruising right along. Let's look at slide 49. Again, we have a male. We've got a hemoglobin of 12.1. That's slightly anemic. Hematocrit is low, but still 3 times. The MCV is normal. The RDW is just slightly elevated. Okay, so because the RDW really is slightly elevated, we're not sure what we're dealing with here. This could be an anemia of chronic disease. This could be an anemia of chronic inflammation. This could be an anemia of chronic kidney disease. but that MCV being normal and the RDW being just barely elevated kind of tells us that the true average size of the red blood cell here in this situation is normal. So we need to go down that path of assuming that this is either blood loss, chronic inflammation, chronic disease, or chronic kidney disease. And so it would be pretty easy to look at some of those other things and really sniff out what we're probably dealing with. Okay? All right, moving on to slide 50. Again, we have an anemic patient. Hemoglobin's less than, let's say this is a female, so it's less than 12. Hematocrit looks reasonable. MCV is low again, fairly low, and the MCH is low, and you have a nice elevated RDW. Now that RDW means there's a lot of variance, but this probably is reflecting reticulocytosis versus it really being a mixed anemia, because we still have an average size of the cell of 70, which is pretty low. Best guess on here because of the MCH is this is likely iron deficiency anemia. It's probably not a thalassemia, but we could get iron studies here and try to figure it out. Remember, if we were going to supplement iron, we would want to start with ferrous sulfate, 325 milligrams, 1 tablet every other day, and ensure that there are dietary changes that are going on to try to maximize absorption of that supplemental iron. So I hope this helps. I hope you all have a great weekend. Good luck studying, and good luck on your exam. Talk to you soon.